Hello everyone. Today I'm going to discuss a case study from physiology. So here we have the case of Mahima. Mahima is a 41-year-old woman who has worked at the cosmetics counter of the department store for years. For many years, there's a lady called Mahima. She has been working at the cosmetics counter. Note the age. The lady is a 41-year-old woman. Mahima's colleagues in the store noted that her physical appearance has changed. Certain signs these Mahima's colleagues have started to see in Mahima. That is, the features became coarse. The lower jaw was protruding. Her teeth are separated. They were concerned that Mahima had a health problems, and one of these colleagues they decided to talk with her. Mahima was a little hurt at their observations made by these colleagues, but when they opened up and expressed concerns of her own, she expressed her own concerns. She disclosed that her menstrual period had suddenly stopped. She has told her symptoms. So that is, the menstrual period has suddenly stopped 5 years ago. 5 years ago. Her hat size, shoe size, and blouse size has increased, and that her fingers have enlarged so much that rings no longer fit. Her hat size has increased is related to the head portion, shoe size has increased, legs, blouse size has increased, and that her fingers have enlarged so much that rings no longer fit. Every night she had been getting up several times to urinate, that is frequent urination, that is polyuria. Mahima decided to see the physician for the evaluation of the symptoms. Physical examination revealed a woman with coarse facial features, a prominent jaw, large hands and feet. Her BP was elevated at 170/110 millimeters of mercury. What is the condition in this patient? This lady, Mahima, she is having acromegaly. Acromegaly. Acromegaly is caused due to increased growth hormone secretion. And this is seen after puberty, that is in adulthood. Acromegaly is seen in adulthood. And how do we say that the person is acromegaly? This patient Mahima, she is having, we have seen that her finger size have increased, her hat size is increased, her shoe size, her blouse size is increased, and also hat size increase means her skull bones have widened. And then we also see her a prominent jaw, large hands and feet, even BP is elevated, her menstrual periods she has missed for the past 5 years. All this indicate that this lady is acromegaly due to increased growth hormone levels. Other questions we see. Why Mahima didn't exhibit linear growth of bones but only widening? Why only linear growth and why not linear growth but only widening? For a second, why did she have increased urination? What is the reason for increased fasting blood glucose level? Why Mahima's prolactin level increased? Propose a drug that could lower Mahima. Why Mahima didn't exhibit linear growth of bones but only widening? Usually when the growth level is increasing, the length of bone should increase. But we know that this hypersecretion of growth hormone after the fusion of epiphysis, it leads in acromegaly, because the fusion of epiphysis, it is before puberty. Is before puberty, and that is after this puberty, the epiphyseal plate is closed, and so the linear growth does not take place, but widening of bones will take place. There is widening of bones, because when the growth hormone level increases after puberty, there is increase in insulin like growth factor hormone and also increase in somatomedins. There is increase in insulin like growth factor 1 and also somatomedins, and these are seen in liver, kidney, muscles, etc. And these hormones, that is insulin like growth factor, somatomedins, all of them have an effect on visceral growth. They have an effect on visceral growth and they have an effect on widening of bones, and so we see widening of bones in this lady's case. Next. Why? What is the reason for increased fasting blood glucose level? we know that the growth hormone level is increased, and after if it is increased, it's lead to acromegaly. We have seen features like jaw, because there is a jaw protrusion of the lower jaw and enlargement of the hands and feet and all that. So this patient has acromegaly, and acromegaly is caused to increased growth hormone level. When the growth hormone level increases, there is increased catabolic effect of fats. There is increased catabolic effect of fats, and so the fatty acid and the glycerol will increase, and so it forms glucose. And so there is gluconeogenesis. So because there is gluconeogenesis, there is increased fasting blood glucose level. That is, the growth hormone level has increased, and so because there is increased growth hormone level, the catabolic effect of fats has increased, and so fatty acid and glycerol is formed, and thereby it forms glucose. And so we know that in growth hormone, so there is gluconeogenesis. Next, why did she have increased urination? Why did Mahima have increased urination? That is, especially in this lady, as we have seen, he has increased urination at night time. That is polyuria. That is osmotic diuresis. As you have seen, there is an increased growth hormone level, and there is increased fasting blood glucose level. So in the blood, the glucose level is increased. Blood glucose level is increased. The blood glucose level is increased, and so in the PCT, the glucose is filtered, and so but the glucose, it is not reabsorbed. So in the PCT, the glucose is filtered. The blood glucose level is increased. So in this renal tubules also, there is filtrations taking place of this glucose in this, but not everything is reabsorbed. Not all of this glucose is reabsorbed. That is, some of this PCT, this glucose, it will escape from PCT. It escapes from PCT, and it escapes from PCT, and it goes into the urine itself. And because there is glucose also in this urine, what happened is, this water will be retained because of the osmotic gradient. Because of this osmotic gradient caused by this glucose, this water will be retained, and it will cause hypertonicity, and so this water won't be excreted. And because at night time, we know that we don't do any skillful activity and it's not taking place, and so this increased pressure, it will cause this urination. Why Mahima's prolactin level increased? Why did the prolactin level in this lady increase? Because acromegaly refers to increased growth hormone level, and there is tumor of anterior pituitary. In anterior pituitary, there are two types of cells: somatotrophs and lactotrophs. Two types of cells are there in anterior pituitary: somatotrophs and lactotrophs. Somatotrophs, they secrete growth hormone. Lactotrophs, they release prolactin. Tumor of anterior pituitary means there is tumor of the somatotrophs and lactotrophs also, and so here there is proliferation of lactotrophs, and thereby the prolactin secretion is increased. Propose a drug that could lower Mahima's growth hormone level. How can we lower the growth hormone level? That is by giving somatostatin. Somatostatin, that is growth hormone inhibiting hormone, and this will inhibit the growth hormone. Thank you guys.